Good afternoon and welcome to our third lunchtime conversation, part of our 55 and Better Expo series, brought to you by the Reporter Herald in Loveland and the Greeley Tribune. My name is Al Manns. I'm President and CEO for Prairie Mountain Media and publisher for the Reporter Herald and the Greeley Tribune. Today's conversation is entitled Long-Term Care and New COVID Guidance for Residents and Families. Shortly after the presentation, I'll moderate a question and answer session, so please feel free to enter your questions using the Q&A or the chat feature on your device anytime during the presentation. I'll accumulate the questions and ask them during that session. This afternoon, I'm joined by Yvonne Myers, Healthcare Systems Director at Columbine Health Systems. So please join me in welcoming Yvonne Myers.
Hi, Al.
Hi. Thank you for joining us.
Yes, thank you. Glad to be here today. I suppose I should share my screen and get my slides up there, huh?
There we go.
There we go. All right. My topic today is really long-term care and our new COVID guidance for residents and their families. It's been a long journey. It's been a long couple of year and a half, I would say. Today is day 466 since the governor and president closed the doors of nursing homes when COVID started. So I remember when we started to meet as a company to say, how are we going to manage this? And our medical director said, I bet it'll be over a year that we'll be dealing with COVID regulations here at the nursing homes. And I thought, oh, please don't say that out loud. Heavens, don't make it true. And here we are at day 466. So I'm going to walk through today a little bit what our journey was, how we started, and then where we are today with the guidance and the regulations with families and visitors and people who may need to come for rehab and visit their family members that are independent, assisted, or in our nursing homes. So I'll start with back in March of 2020. We were actually the first COVID positive nursing home patient at our North Shore facility in Loveland, first in the entire state. Isn't that fun? Yay for us. The positive about that is that we had absolute tight, constant attention from the Colorado Department of Public Health and Environment, the Larimer County Health and Environment, as well as the CDC. We actually had an infectious disease nurse fly. She was flown out here and spent time with us at our North Shore facility and learned with us. So being first has a few advantages, I suppose. We also had the first positive person in Larimer County. So yay for that as well. So good for us. I will tell you what we learned through the journey that we've been through is that the importance of PPE, the importance of masking. And I'm not going to get into say some things that may seem political to some folks, and I don't mean to, but what we did learn is during the time that we started wearing masks, we also didn't have flu, we didn't have RSV, which is another sort of upper respiratory infection. We didn't have people with colds. And when we first started with COVID and we would test, we would actually catch other things like flu and RSV. And so that was paramount and important. And then when we had the big outbreaks in the fall and then in the wintertime, adding the face shield as another set of protection. And you can't imagine what it's like to work. I know we've all seen pictures in the news and of folks with their gowns on and their face shields and their face masks and how hot and hard that work is. But it really, really was important to get this infection under control for sure. Testing. We still are tested. Columbine has been testing since last June, at least weekly. We test with Colorado State University. We spent most of our time with them. We had a little bit of a journey with Curative for about 2 months, but otherwise we've tested with Colorado State University, and their testing is unbelievable, impeccable. They're great to work with. And without that testing and seeing where it is, I will tell you that working with older adults, it is really hard to see COVID. Their immune system doesn't show it like a younger person. They maybe won't eat dinner tonight. Maybe they had a little bit of a stomach ache. Maybe they had a little cough, a little low grade fever, not 102, just 99, 98, something that was a little higher than they normally have. And that would be COVID. And so the testing was invaluable to us to see where COVID was and who had it and all of that. Quarantining areas, we created parts of our nursing home where there's that's where the COVID is, and areas where there wasn't the COVID. And we actually also moved staff. Staff only worked in certain areas, didn't work in other areas. If you worked on the COVID unit, you had a separate door. You didn't work in other areas as well. So a lot of cohorting of staff, a lot of cohorting of residents, and creating COVID areas and COVID barriers for people. In the beginning, they weren't sure, is it airborne? Does it touch stuff? Maybe it's all of that. And so we had to wipe off everything that came into our buildings, everything that you might imagine that you would bring. And so imagine when the doors are closed and your mom lives in an assisted living, and she used to be a seamstress, and she says, well, if we can't have activities and I can't have visitors, maybe I'd like to have my sewing machine back. And so the daughter would drop off the sewing machine, and we would have to wipe it down completely before we could give it to her. And over time, as you know, they've really learned it's more about airborne and not so much on surfaces, but we still do a lot of high touch surface cleaning, handles of doors, places where people are eating and sitting. So that's the high touch surfaces still is going on, but it's not as hard as it used to be in the beginning. How we survived, we had an emergency operations center. We just lifted up a team of people. I was on that center in that group, and every day we met all together in our tavern of the Drake Center, if you've ever been to the Drake Center here in Fort Collins. And every day, sometimes in the beginning, it was 7 days a week, 14 hours a day, to work through the guidance and the protocols and work with our partners at CDPHE and the county and the state. We were very lucky in the beginning when they mandated PPE. We didn't have enough PPE. We don't carry that much PPE. We're not, normally long-term care doesn't, during RSV and flu, we have gowns and we have masks and we have that, but we did not have enough for everywhere, independent living, assisted living, all of that. And you couldn't get it and find it either. And how are we going to extend the use of it? When they mandated it, we figured out we had a week's worth. How are we going to deal with that? So we actually were approached by a company. We learned about it through Associates in Family Medicine, and it's bed bug technology, and it actually uses heat to decontaminate. And he did get emergency use authorization for his Thermal Strike Ranger. It's actually technology it's a case that would clean your suitcase from bed bugs. And so we were actually able to disinfect our masks, and we don't do that now. We have enough PPE, and we actually are now, every time you use it and you take it off, you have to throw it away. So it isn't even, at one point we were using them the entire day, and now that's changed as well. Paper bags, that's how we stored your face shield. You got 5 face shields, and we store it in a paper bag till 5 days, and then you would wear that face shield again on the 6th day. And that we don't do that anymore either. We survived because our residents were brave and strong. Oh, I knew I was gonna cry. Many of them said, we've been through World War II. We survived. We do what our country asks us. They were brave, totally, sorry. Our staff stepped up and were family members. And our families were amazing. Can you imagine being told you can't come into this building, cannot see your mother, you're gonna visit her outside the window, you're gonna hold a phone, you're gonna talk to her. Maybe she has dementia, she doesn't understand why you're on the outside of the window. Maybe she has macular degeneration. She can't see you out the window. She can't hear you on the phone. I think our families were patient. And if they weren't, if they were a little impatient, we totally understood that. They were just amazing. So then the vaccine came. Yay, what a miracle. We were one of the first to get the vaccine through Walgreens. Our first vaccinations were given at 8:10 on December 28th. We're only able to give vaccine to the assisted living and the nursing homes and our staff in those buildings. And we were like, what are we going to do? What are we absolutely going to do for our independent livings and our patio homes? And a miracle happened. UC Health said they wanted to practice doing vaccine clinics in the community, and could they practice with us? Did we have a need for vaccine? And so luckily we were able to get vaccine from them, and they vaccinated all of our independent living residents and our patio home folks at the Drake Center. We had to bus everybody in. We made them wear masks and face shields, and we screened everyone, and we weren't going to give anybody COVID at the vaccine clinic. And so we started vaccinating, and we found after our first vaccine clinics at all of our buildings by mid-January that only 50% of our staff were taking the vaccine, and our residents were at 97%. And we really felt like we needed to listen to our residents and their family members who were saying, we want the vaccine for our loved ones, residents saying we want to take them. And so we decided at the end, about the second week of February, to let our employees know that we would mandate it beginning April 1st. And so effective by the 1st of April, unless you have a medical reason, obviously a healthcare reason, and a physician will assign to that reason. And if you have anything to do with pregnancy, being pregnant, wanting to be pregnant, we weren't going to get in that space as well. So after announcing all of that and walking through and educating employees, we have around 70 employees who are exempted for different reasons. And then we lost about 50 employees who chose not to take the vaccine. And so we've replaced those employees with those who do want to get them. We felt like we couldn't mandate it till we had it. So then we had to work hard to get the vaccine. So we've actually purchased a medical grade refrigerator freezer, and the first one failed. And so we had to get a second one, and it is monitored by the CDC. It has to have a monitoring device on it. We are able to have Johnson & Johnson and Moderna. And if we hadn't gotten the vaccine by March 23rd, we were suited up with the vaccine. If not, we would have moved that April 1st date back. So all new employees and new hires are offered the vaccine. And we're actually finding, if we have new hires, 20 people in the new hire class, about 5 need the vaccine. So many people are coming to us vaccinated, which is great. So let's get to really what the sort of big topic is. And it's sort of like we closed the doors March 12th of 2020. And how are we letting people back in? So at first, all the doors are closed, and then everyone said, wait, what if my mom is on hospice? What if my mom's dying? How can I not come into the building? And so the CMS and the state then allowed what they called end of life visits. Well, that was hard to decide. What's an end of life? And when is it end of life? And is it the last 2 hours? And that just, you can imagine, got very complicated. And so then came after that pretty quickly was what they called compassion visits, meaning maybe I just got diagnosed with needing hospice, or the decision was made and I'm not actively dying right now, but I need someone to come and see me. Maybe I'm very sad. Maybe I'm very lonely for my family. Maybe I won't eat unless my husband is feeding me. And so could we then have you come for a compassion visit? So there were rules about that. And then there became essential visits, like, well, shouldn't the lab come and see you? And shouldn't x-ray people come in? And those sorts of folks became essential to residents as well. And then there became the list of required visits, like we must let in the ombudsman, adult protection, any faith-based visitor that comes in must come in no matter what. EMS, right? So the ambulance and folks as well. Because I think across the way, we didn't do it at Columbine, but we would hear across the country where people were scared to let anyone in. And so ambulances were having to be screened, and the drivers to be sure they didn't have COVID. And they said, you can't do that. You have to let them in. So that's kind of how we moved to letting people back into our buildings. And so, but still not families. They weren't on that list unless they met the criteria for that essential or compassion. But as a regular rule, you couldn't just come in and see your loved one. And then they said, well, it's summertime, July. June, we got guidance that said starting July, you could do outdoor visits. Well, that was fun to start opening visits on July 6th, one of the hottest days of the year that we have, and have people outside. And so we started visits earlier in the morning because 2 o'clock in the afternoon would be hot. We had to screen people. We had to set up tables. You had to be 6 feet apart. We had to supervise folks. I would say the hardest part of those visits was your mom can't hear you outside with you talking with a mask across a 6-foot table, and you'd want to take your mask off. Your mom would take her mask off, and we'd have to say, you have to put your mask back on. So it wasn't the greatest visit, but it was visits and people could visit. And so we had to schedule those, and that worked out. And so then what are we going to do as it's getting cold? And we keep waiting and waiting. What's going to happen? It's now September. It's now October. What are we going to do for visits? And finally, near Thanksgiving, they created the indoor visit policy. And so we had to create specialized areas within our nursing homes that are where you could visit. You had to schedule. We would escort you to that visit. You would visit with your loved one. We have to clean that area, bring the next visitor in. And so we then had a plan for indoor and outdoor. And I will tell you, some of our family members, they're from Minnesota, they're from Michigan. They said, we'll just visit outside, give us a blanket and some coats, and we'll be just fine. Our mom will be just great too. So there was still outdoor visits even in December sometimes. It was great fun to see. Then on April 27th, 2021, the new CMS guidance came out that said vaccinated visitors could go visit their moms. I don't think you'd even said that. Sorry, nothing about vaccinated. If you could come in and see your mom and you could visit her and hug her in her room. And that was such a game changer. Like you could actually be in the buildings. It was a big darn deal. And here in Colorado, the state said, well, we know what CMS has done. We're waiting to come up with our guidance. And so May 31st was Memorial Day. So in the afternoon of May 31st, we received the new guidance. And so I'm going to sort of walk through the different levels of care because there's different guidance for each. So at our independent livings, they're not licensed. No independent livings in Colorado are licensed. And so they do have to follow the restaurant guidance, right? Because they are restaurants and so they're surveyed for that. But other than that, they don't have regulations. And so required by the state or CMS or anyone. So we followed the Larimer County guidelines. So as the things would open up in the county, restaurants would open to 50%, we would open up our independent livings to that 50%. And we did outdoor visits outside on patios way back in the summer. And we tried to be sure that our independent livings had more restricted rules than the nursing homes and that people could be more free to go. But I tell you, we were scared too as a nursing home company as well. We just didn't want COVID to be anywhere. And I'm sure our residents that are independent livings would be like, you could have moved a little faster. But I think now everyone feels glad that we were pretty conservative in what we did because everyone is safe and that's a good thing. The assisted livings follow all the rules of Colorado Department of Public Health and Environment because they are licensed by the state of Colorado. And nursing homes, or as they're called officially by CMS, Center for Medicare and Medicaid Services, they are called skilled nursing facilities or SNFs. And after working in nursing homes for 38 years, I'm really used to being called, I work in a SNF. But I know when I say that outside of long-term care, people are like, you work in a SNF? That's awful. So you're a SNF. So for the SNFs. So currently right now, the guidance right this minute for our nursing homes, our assisted livings, per the guidance with CDPHE that came out on May 31st, masks are not required. If you come in to visit, masks are not required if you are fully vaccinated. And as we know, fully vaccinated means 2 weeks past the last dose of your vaccine. So if you take Johnson & Johnson, today you get it, 2 weeks from today, you are fully vaccinated. If you take Pfizer, you get the dose today, the second one 21 days from now, then 2 weeks, you are fully vaccinated. Moderna, you get the dose today, 28 days, and then 2 weeks later. So it's 6 weeks, 4 weeks, and then 2 weeks. If you're fully vaccinated, we screen you at the door for symptoms, right? We still have to take your temperature. We still have to ask you questions. Have you been around anyone? All of those sorts of things. And then you have to show that you're vaccinated. We must have proof. It says in the public health order that we must get copies of your vaccination card and keep them. And so we've had some families that have said, well, that's a HIPAA violation. And I know, again, sort of a political conversation, but, we do need to know. And, the death rate is high in the population that we care for, and we really need to be sure that we have fully vaccinated folks. Because if you are fully vaccinated, you come to our assisted living, no masks, you can attend the activity with your mom, you can eat in the dining room with her, you can go on outings if we're doing those, and you can visit whenever you want. Some of our buildings have visiting hours just because they want to be able to staff it and help you, but it's all day. It's 9 o'clock till 5 in the afternoon, and they only say, don't be going up and down the hallways, visiting every single resident. Don't hang out with everybody, but you can come in, go to your mom's room, go outside, take her down the hall, out the door, that kind of thing, if you are fully vaccinated. So prove it. If you show up for the visit and you don't have your vaccine card and you can prove it, then we have to treat you as unvaccinated. So if you're coming, bring your card, your Pfizer card, your Moderna card. In our nursing homes, as I told you before, they have to follow what CMS says, as well as what CDPHE says. And so at this point in the nursing home, masks are required for everyone, vaccinated, unvaccinated, staff, residents, families, people have to wear a mask. So if you come to visit there at the nursing home, then we will, again, screen you. We will ask you for a copy of your card. We will give you a mask if you don't have one. And at that point, you can attend activities. So go to the dining room, go on to outings, visit where you want. They've really given a lot of capacity and ability for fully vaccinated folks. Not so true for the unvaccinated. So maybe I should talk about visits of roommates, and we'll talk about unvaccinated. So if I live in one of our nursing homes and I have a roommate, or in one of our assisted livings, if I had a roommate, most of them don't, but if they did, both of us have to be fully vaccinated in order for the visit to occur in the room with a fully vaccinated visitor. And I have to agree to the visit of my roommate. My roommate has to agree to that visit if I bring someone in. And we can't have our visits at the same time. Both of our children can't be visiting us at the same time in our room. And again, it's all about what we're all kind of asked to do too, is sort of think about distance and think about how many people are in that space. And in a smaller room or in a nursing home area, a lot of people together is sort of something that they want to keep us farther apart for sure. Unvaccinated visitors, they've not given much capacity for that. If you are unvaccinated, you have to schedule the visit ahead of time. You can't just show up at 10 o'clock this morning and say, I want to see my mom, screen me, let me through. You must schedule ahead, and you can only visit in 2 places. And that's in the visitor area that we established last fall, in the facility, or outside. You can't be in any other places in the nursing home. So I think they are really encouraging people to get their vaccine. Our facilities are reporting that at least 90% of our visitors are vaccinated. So as our 90-year-old residents have gotten their vaccine, so have their children and their other family members. And so we're not having as many unvaccinated as you would think. So we're excited about that. A resident is not mandated to take the vaccine, right? We can only mandate our employees at this point. And residents never have been mandated. You don't have to take the flu shot, in fact, or the pneumonia shot or anything. We highly encourage you. We give you lots of information. We can give you the shot at the time, but you don't have to. So we are vaccinated at about 97% in our facilities. In the assisted living that follows CDPHE guidance, if you are a resident that is unvaccinated and you want to join the activity or go to the dining room, you have to be socially distanced from everyone else for 6 feet and wear your mask. That's all that has to happen. Everybody else is fine. At the nursing home, it's a little different rules because it follows CMS. Whoever's the more strict rule is who we have to follow. So at our nursing homes, if I'm an unvaccinated resident and I decide I want to go to the music program and I go into the activity room, all the residents have to wear masks, as well as me. And so I think there's some message there around everybody in the building working with each other to get vaccinated. I really think that's the deal. And as this guidance has opened up and allowed families to visit more, especially if everyone's vaccinated, the resident and the family member, we have actually seen more residents take the vaccine. They're like, okay, now my son can visit with me. I want to take the vaccine so that we can have better visits. So we have seen a little bit of uptake with these new rules making that happen. I will tell you, I think I sent 10 emails to the residential care strike force, who are the folks at CDPHE and the surveyors who survey us, those groups, to bring entertainers back. I mean, it is, there's only so much the activity directors can do. And if entertainers are vaccinated, why couldn't they come into the buildings, right? And so finally, with this new guidance on May 31st, they said fully vaccinated entertainers who, again, prove that they're vaccinated, go through the screening like everyone else, can come in and perform. We are asking that they wear their masks. We've had a few entertainers say, well, I can't sing with a mask on, and I fully understand that as well. But we really feel like, again, we're bringing someone new into the environment. And so, sometimes we're a little conservative, I think. But the other day, I heard banjo music and people were clapping and residents were happy. And it was very, very exciting. Throughout this whole year on our Facebook page and our newsletters, on any ads that we did, everybody had their masks on. I mean, that's how it is. We're all wearing masks. All the views of us are wearing masks. And just this last newsletter that's coming out for July, we have residents without their masks on. And not only is it great to see your whole face, right? We're so excited about that, but to see their smiles from ear to ear. Their smiles are from ear to ear. They're just, everyone's happy they're together again and they're doing more with each other because they're vaccinated. So entertainers are part of that mix and part of that happiness and getting back to regular life like we all are, right? That's the goal. So if you are new and you're coming to our facilities, you're coming to our nursing home for rehab or maybe for hospice, or you're coming to our assisted livings, If you're not vaccinated, you do have to be in 14 days quarantine. And what that means is you have to stay in a private room. You can't leave that room. They do as much therapy as they can in your room and a little bit outside there. We are allowing visitors at Columbine to come, not a lot of visitors and not a lot every day, but visitors of new admissions who are unvaccinated. If you are vaccinated, you can come, and then we give you full PPE. You do have to wear the mask and the gowns and all of the things to visit. But, if you're someone who just went to the hospital, had some health issue happen, and now you're finding yourself in rehab, we really wanted your family members and people who support you, or if you're that daughter and now your mom is there, that you were able to come into the building, meet the staff, see where she is, get to see her as well. So we have allowed that. Don't know if everyone's doing that, but that's what we're doing at Columbine. If you are a fully vaccinated resident and you're a new admission, you're not on quarantine, and your family can visit in that same way. So that vaccination status is really the driver. It is absolutely the driver. And I read an article today that said really the vaccine uptake in people 30 plus has been amazing. It's really this 18 to 30 where they're having a little bit more issue with getting people going. And from what we have seen, I think those of us who are 50 plus have really stepped up and taken the vaccine in Northern Colorado. So if you're one of those, thank you very much. It's great. Testing, we still have to continue testing. And the rule is if we're at 10% positivity rate over the last 2 weeks, then that drives that number. And right now, Larimer County is at like 1.6% positivity rate. And I think Weld County is like 3 point something, 3.8, 3.6. So we're way below that 10%, which is amazing and awesome and wonderful. So because of that, we only have to test 1 day a week of any unvaccinated resident or staff, or if you're a resident and you went out of the building, you went to a party, you went somewhere, it wasn't a medical appointment, but somewhere longer, a family reunion, that kind of thing, and you've been out of the building in the last 14 days, then you get tested during that once a week testing. So we still have that testing going on. As you know, in the state, they changed the definition of what an outbreak is. So if you are a school or a business or a hair care center or something like that, and you have to have at least 5 people positive to make you in an outbreak. They changed that about a month ago, 3 weeks ago. And in nursing homes, it still is 2 positives put you in an outbreak. Staff or resident, doesn't matter. 2 positive, 2 staff, 2 residents, 1 of each. If you have 1 positive, so we do that testing, and or somebody goes to the hospital and comes back and they were tested at the hospital because they were at the hospital and they're testing them and they're positive, then that causes us to go into testing mode, which means then we must test all the residents and all the staff to see if it's anywhere else in the building. And then if you do catch a second person, now you're an outbreak. So I really think that's going to be part of our new normal. That's what's going to happen. When COVID came again, because I've been in long-term care for 38 years, I remember when MRSA came. I remember when AIDS patients were coming, and RSV was something that was only in children, and now it became into older adults. And so each one of these infections, diseases that come our way, we just have to figure out how to manage them and how to live our long-term care life with them as well. So COVID-19 will be part of our new normal. It'll be interesting to see, all the articles and things that I read. Is it going to be a seasonal like the flu is? And that's kind of how it happened, right? It got real bad over November, December, January, just like the flu, and got better as the weather gets warmer, as we're more outside. So these new protocols will be there, where we are trying to move on from it. We know we have to manage COVID, but let's get back to what we do, which is taking care of older adults in our nursing homes and getting back to activities and life again. The flu and COVID vaccine will be required for all of our staff. The other day, I read an article that said they might make a vaccine where they're both in one. And I thought, oh heavens, you'll feel really bad the next day, won't you? You'll have all the things that happen when those vaccines just for the 24 hours. When I had my COVID vaccine, I did feel bad for a day. I came to work, but I was feeling punky, I'll tell you that, but I didn't care. I was like, thank goodness I'm feeling punky. It means my immune system is kicking in, and I'm going to really be able to, help our residents and help our community and help myself with not having COVID. And when I got that second dose, we had Pfizer here that time with Walgreens. When I got my second dose, I can't tell you, I was like, yes. And then when that's 2 weeks later, I was so happy and excited. So, I think if you didn't have some side effects, you might not feel as good about it. I felt really good about having those, knowing that I was really working hard. My body was working hard for that shot. And I would tell you that the focus on infection control has always been something in nursing homes, but I will tell you, it is to a heightened level. It is to a heightened level in healthcare, right? And I hope the side effect of COVID is that we will all wash our hands like we're supposed to. We've been told for decades to wash our hands to stop spreading things with each other, and that continues, and that using of hand sanitizer. I'm going to keep it in my car, and after I've left a shopping center or shopping, that I just do that, right? Because it's just a good, safe thing to do. So those processes are top of our mind. The amount of PPE that we use, and our staff knowing how to don and doff PPE and wear all of it, and when you wear it for this contact precaution, and when you wear it in quarantine, and all of that is just, we're experts at it now. Everybody in healthcare is experts in all of that. And also reporting and recognizing any slight health change. As I shared in the beginning, the older adult doesn't really show COVID like a younger person does. And so really all of our teams, all of our staff are trained to, if she just, today when you come into my room, and normally I'm friendly and I say, how are you today? And today I say, how are you? You might want to report that to the nurse, because that can be just enough of a sign for us to figure out that maybe we should check you a little bit more and see what's going on, and see whether COVID is in your world or not. And I think I finished a little bit early. Sorry about that, a quick speaker. So I'm super excited to be here today and to answer any questions that you might have. It has been a very weird, crazy 466-day journey. And I'm sure if you have been involved with anything in long-term care, you're like, what the heck are they doing next? So hopefully I cleared up some of your questions. And if not, I'm excited to answer questions.
Yvonne, that was outstanding. I don't know that there's many people in today's society that wasn't impacted by some of this. My mom lived in an independent location in Pennsylvania, and Anne Marie's mom, my wife's mom, is in a memory care facility in Virginia, and we were constantly getting. And so it's interesting. It's interesting how intensive. My sister ran skilled nursing facilities and assisted care facilities through the years too. So she worked as a person who was in control of managing the cleaning and the infectious disease questionnaires and things like that that were nowhere near what they are today. I found it interesting that you said that older people didn't show COVID. Did you have many hospitalizations within your facilities?
That's a really good question. So with our being the first ones, right? So when we did that first round of testing, which was a bit crazy because the state wasn't really set up. That's a whole nother story. But we did have a few folks that chose to be hospitalized at that point. After that, we really, our infusion pharmacy was able to get the monoclonal antibodies. So we were able to then administer that to folks at our facilities. So that lessened that as well. And because we caught it so much earlier between the testing and we were required to do vital signs, listen to your lungs 3 times a day, all 3 shifts, right? And so we were catching this really early in the disease process. And so most cases, people were not hospitalized. Many people got better. Our very first resident is still with us, and she's 98 years old, and she just survived it. We did have deaths, and in some of those cases, people then became hospice and stayed at the facility and chose not to be hospitalized at that point. So.
And I find it fascinating when you talked about staff and mandating shots, because it's not unusual for healthcare workers to be required to have hepatitis or flu, tuberculosis, and other vaccines. But for some reason, COVID, got this political football thrown around on it, and it somehow became different than those other vaccines, which are, readily accepted. So
Yeah,
it's fascinating.
absolutely, absolutely. It is fascinating. And I think there's two components to it. One is that it's the emergency use authorization. That's where a lot of people are stuck, right? That it didn't get full FDA approval. And so how can we mandate it? How can I take it? And yet, after millions and billions of people have, I think we can say it's okay. But the other part of it is, and it was real interesting when the CDC new director came with the change in, national leadership, because most of the people of our staff, even who questioned it, who we had to have individual meetings with or small group meetings and really talk about it. And we had our medical director do a video herself, and she got vaccinated really early in December, as physicians could over at the hospital, and really talked about what it felt like to her. And, she did this great video for us. It was really younger people through social media, right? So some of the things that were flying around through that, where that's not monitored, right? And things can be said. And so the new Dr. Walensky, who now runs the CDC, said the CDC really had no social media platform. And so there was nothing coming to counteract the things that were on social media. So as you said, that football started flying and there was nobody to catch it and say, that's not right. This is not true. It doesn't, they're not putting chips in your body. It doesn't give you metal, those things that are kind of out there in that space. And so, it's really been too bad. And now we're kind of stuck, like with the variants coming, we really need that vaccination space. Otherwise it'll just keep. I'll end with years ago, like when this started, they talked about how the virus wants to live and it'll continue to mutate. So when it was killing a lot of older people, well, then its host dies. So then it varies to go after younger people, right? I mean, it wants to live as if it's a thing, a live thing that thinks, but that's what happens. And so, the science says vaccination is the way. And so we really need that football needs to be caught and people need to vaccinate. And we are proof of that. We don't have, right now we have a few people with COVID, but we have no COVID like we had before. And that's as soon as we were fully vaccinated, that happened. So we are the science to tell you that, to get your vaccine.
Yeah, and I think the science is also showing up in the counties that have low vaccination rates. A good example is in Colorado. We have counties that have 15 to 20% and 25% vaccination rates. Their COVID percentages in the community are much higher as a percentage of the population. And I even found this,
Exactly right.
it interesting, that New York Times ran an article to an op-ed piece today by a couple of people who presented it, and said that does the vaccine have side effects that we're not hearing about? And they talked about the heart lining inflammation issue, but if you look at the stats on it, it's 0.0001% of the people who have received the vaccine have gotten heart inflammation issues. If you have COVID, it's 2.3%. So it's like what risk do you want to take? So it's interesting. I'm curious too. What kind of impact have you had with staffing? Because I'm on different boards, and a lot of the leadership in the community talks about how difficult it is to hire. Even in our own company, we're seeing that. Are you running into that same situation where you're, like the airlines are canceling flights because people are coming back to the airlines and they don't have the staff to handle it and things like that?
I know. No, exactly. So, as I said, we lost about 52 employees because of not wanting to take the COVID vaccine. Some said, I really wanted a job change, or I don't want to work in healthcare. I realized maybe healthcare isn't for me. And so the vaccine was their reason. So there weren't as many that didn't want the vaccine that kind of used that as the reason. But we have lost staff because they're worn out, they're tired. We've had a few of our nursing staff say, I don't have another job. I don't know what I want to do, but I don't want to do this. And so I do think that what COVID did show what it means to be in healthcare, right? What it can mean, what the extreme part of healthcare can be. I'm excited we have new people coming in that want to be nurses. So I think they'll understand what healthcare is about, right? And make those decisions. But yeah, we have closed down one of our nursing homes. We've closed a 15-bed wing, and we have a new addition in Windsor That's 30 beds that we have not been able to open because we cannot find enough RNs to staff the building. And when you listen to our hospital friends, I'm on, like you, many calls and boards as well, and they have felt the pinch of travelers, right? So if you want to travel as a nurse, and if I'm 25, not married, and I can get paid $150,000 to be a nurse, I'm gone, right? I'm traveling all over. And so the hospitals picked up some of our employees, right? And then we're taking them from, there's not enough, and there aren't enough in the pipeline to replace the exodus that we had as well. The nursing shortage has been an issue. So, we're still doing lots of hiring, and we're worried about chefs because chefs will go back to the restaurants when they open, and yet, you know what I mean? And so, but I'm like you, I'm hearing it's everywhere. I was on a chamber call, and a woman there said she has never paid bonuses for tellers. And she's now offering a bonus program to get tellers to work at the bank. So it's in
almost
every sector.
I don't care what position you're looking at. There are openings all over the place, and limited applicants. What about supply chain? Are you seeing supply chain issues?
Well, we're getting nervous about it. So we have waiting for things. Things are not furniture, desks in our new addition, that kind of thing, waiting for them to be built to come in, that kind of thing. Just yesterday, I was on Monday on a Fort Collins chamber meeting, and a gentleman from Otterbox talked about how ships are stuck in the port, and there's no reason for ships to go the other direction because we're really the only open economy at this point, and places in North Korea and China are closing because of he said that the vaccine efficacy in China is only 35%. And so they're still seeing a lot of COVID, of course. And so we so we buy adult briefs overseas from China in a shipping container, right? And we buy almost a year's worth, like 9 months worth. And so I immediately went to our purchaser and said, I think we got to get that ordered now. And the Otterbox gentleman said they were ordering 2 years out because thinking about getting that supply. So I heard also there's no pallets. So people are struggling. So if you want to ship things and you can't find pallets to put your things on those pallets. And so if you own pallets, I think you could sell them for quite a bit of money. And they were talking about how, you used to just throw your pallet out by the dumpster, your pallets, and stack them up at the back of your building while they're being stolen because they can be sold. And so that's also part of that national, that supply chain, because we're so connected. And someone told me yesterday, as I told them this, that they'd heard that we might not get all of our holiday things we're used to because of the closures over in China and Vietnam and other places like that. And so, COVID is a global impact, right? And I think we'll get the disease figured out quicker than we'll figure out the economy of it, right? It's going to
I guess the way you have to look at it is, we've spent more than a year in really a shutdown mode in many manufacturing organizations, and it's going to take a while to recover from that. And of course, inflation is also impacting pricing, and that's going to impact, your residents and families and things like that moving forward.
Absolutely. Well, PPE, a surgical mask was anywhere from 1 to 2 to 3 cents, and it's now 10, 15 cents. And when you go through, officially, every time I take mine off, I have to put a new one on when I'm working at the facility. So we're going through them like crazy. And surgical gowns that were $1.50 are now $8. So, right.
That's incredible. That's incredible. That's the reason I wanted to ask that question. You have some real life examples. Do you see PPE? One of the things that I find fascinating is how much less flu and cold and all the other viruses that are spread readily in our societies are down so much. Do you see that continuing, the protections of PPE continuing into the future because of that within your organizations?
I think so. I think whether it's mandated or a guidance that comes to us that we have, it's practically a mandate, or we choose it ourselves. I've said, and my degree's in human development, so I'm not the healthcare girl, but I've been in healthcare a long time, but is really, we'll probably be wearing those masks from October to April, right? During those times. And,
you still wear one when you go to a food store?
you know, it's funny. I had a real hard time because we took them off here at our management. We're an office, right? We're not, if I go into the buildings, I have to wear one, obviously. And the first time I went to the grocery store, I wore it. I didn't know what to do, but I was kind of shamed either way. You know, if you don't have it on, people look at you. If you have it on, they're like, well, you must not be vaccinated. And it was tricky, right? And then I found the next time I went, I wore it in the vegetable section because there was no social distancing. And then up and down the aisles, I took it off. And I've kind of gotten used to not wearing it. I've told myself I absolutely believe in the vaccine and I have to honor that. I have to be okay with that. But I do think that we did show, and in our buildings for sure. I mean, the only thing we changed when we started testing was that mask. And we had no more RSV, no more flu, no more that being caught and tested.
I would say the other thing that, you know, for our buildings, it was more intensive cleaning. And people using hand sanitizers regularly and washing their hands regularly, and people stopped touching each other. You know, now when I see people, I put my fist out, you know, and I pop them with my fist. I never shake hands anymore. And that was you know, being in business, that's the most common thing that you do all day long. And so I sort of always
shook their hand and then you rubbed your eye, right? Right. And I think also, you know, how many people went to work sick? Right? They're like, oh, it's not that bad of a cold, and then hacked all over the place and coughed, and you're like, ah. And now, you know, I know more about my own employees when they're unwell than I ever did before because they have to tell me so much stuff, right? And so if you have a little bit of a cold, stay home, and then you rest and you come back and you don't get super sick and come back to work. So, you know, I hope those are some of the side effects of COVID so we can all live healthier. I haven't been back to the health club. I'm still a little nervous about that, and not because I don't think they're safe. I just need to gear up and give that a try.
Same here. So, But, well, you know, you've provided so much wonderful information for our listeners and for people who will watch this presentation later on. Yvonne, your information was invaluable, and you know, it continues to be something that we read about and hear about every day, and you guys have to face. And I can tell you from my perspective and others who are impacted by your industry, we're so thankful that we have people in this industry that took such great care of people who were really in a position where they could not see their families for such a long time. And you know, I get to see my daughter for the first time in 2 years. We're going to Belize on next Friday, so
congratulations.
We're looking forward to that. But I just want to thank you so much for your presentation and your support of this program. And we hope to see you again in the future on another presentation.
Great. Thank you so much, Al. Thanks for the opportunity.
Thank you. Bye-bye.
Bye-bye.